My name is Alington Ndlovu, and I'm from Africa. I'm working for Amagugu International Heritage Center. So I'm going to take you through a presentation about indigenous knowledge systems. And my topic is indigenous knowledge systems as a vector in combating COVID-19. I'm trying to share the screen right here. Just a moment, please. Just a moment. Our topic is indigenous knowledge systems as a vector in combating COVID-19. COVID-19, right? I'm trying to do the little magic here so that everyone is aware. All right, thank you. So we are going to start by the definition of some key terms so that we move together in this presentation. COVID-19 is coronavirus 2019, and to combat is to battle, to fight is a struggle for victory. And a vector is a course towards a selected point. It's a course towards a selected point. And traditional medicine. Traditional medicine, we're talking about traditional medicine in the sum of, for total knowledge of practices that enables diagnosing, preventing, and eliminating a physical, mental, or social disease which relies on IKS experience. Right. So our introduction, Malkia, cited by Eong in 2007 defined indigenous knowledge systems as to what indigenous people know and do and what they have known and done for generations. Practices that evolved through trial and error and proved flexible enough to cope with change. Now, if we take this as our working definition, then it becomes easy for us to understand that since time immemorial, people have always resorted to their indigenous knowledge systems for survival, and these are a living proof of humankind's resilience. With their indigenous knowledge systems, they've survived invasions, they've survived pandemics, they've survived outbreaks for centuries. And at this point in time, indigenous knowledge systems may still be used as a vector in combating a COVID-19 pandemic. Now, thanks to the Chinese teas, Madagascar's herbal remedies, the sub-Saharan medicinal plants, organic agriculture, traditional diets, and relying on the advices from the elders of the communities. Now, one can submit that indigenous knowledge systems, including modern clinical interventions, can indeed help fight COVID-19 and improve food security that has been shaken all over the world to fight COVID-19. Now, you'll discover that indigenous people can resort to hot water bath therapy, which is ukufuta in the isiNdebele Zimbabwean language, which is in Africa. That automatically kills the virus in one's windpipe. They can also adapt to indigenous food preservation methods in order to sustain consumption of food and cultivate their resilience when there is lack of food security. The Agenda 21 of the UNCED conference emphasized on the need for governments to work towards incorporating indigenous knowledge systems into contemporary socio-economic development programs in order to attain sustainable development, that is according to Helvetas 2011. Now, some of the indigenous ways of knowing that can be incorporated in extenuating or battling COVID-19 will be talked about as the presentation unfolds. Right, you'll discover that there are quite a number of aspects that constitute indigenous knowledge systems. And one of those components is the use of language. The use of language is one of the most important components of indigenous knowledge systems. And one of the pivotal aspects of dismantling and eliminating a threat or a crisis is understanding it, knowing what it is, its causes, its limitations, and delimitations. And in most cases, this is usually best understood in the people's native languages. So we are talking about communication. And the World Health Organization proposed that Africa especially have relatively weak health systems, proactive measures to prevent the spread. Therefore, to contain and to eliminate the spread of the virus will be critical. Thus, indigenous people can turn to their indigenous knowledge, and countries should step up campaigns to educate the general public on best practices. This can be achieved through using people's native language to ensure the effectiveness of certain campaigns that are set up by governments across the globe. Now, the information on flyers used should be translated to guarantee maximum coverage. Some of the reading materials and media content that is meant to help and equip members of the public does not serve its maximum purpose, and it is delivered to the wrong audience. So now we are saying that through IKS, there is need for people to understand the messages that are conveyed by the World Health Organizations. And all these messages, they come in English language, but we are having over 1,000 different native people in the world. So the translation part comes into play, whereby we translate all those messages, the preventive measures on how to stay safe. They have to be translated to the native languages so that the messages or the campaigns are effective and they reach the intended audiences. Right. And the second aspect of IKS in combating COVID-19 is incorporating indigenous knowledge systems in agriculture to combat COVID-19 and ensure food security. Now, several indigenous people from different regions have identified hunger as the main effect of COVID-19 crisis. Food shortages are resulting from the combined effects of isolation, remoteness, the lockdown, the disruption of the food value trade chains, and the suspension of income-generating activities. Therefore, inasmuch as the world is devising methods and means to cure and prevent the spread of the virus, it should also work tirelessly in handling the negative effects that befall communities due to this crisis. And we're talking of hunger. Now, indigenous people should work towards incorporating indigenous knowledge systems related to agriculture in battling COVID-19. For instance, they can adapt to climate change and explore their resilience skills in farming, drought-resistant crops, and those that are quick to ripe like cowpeas. And you also discover that from indigenous knowledge systems form a basis for community-level decision-making in areas pertaining food security, human health, more importantly, the use of natural resources in battling this novel coronavirus. Local communities can also resort to indigenous food preservation methods to prevent their food stock from getting spoiled and to sustain consumption of food. Now, a wise man once said, growing your own food is like printing your own money. So perhaps by plowing their own food, they may counter economic challenges at household level and ensure food security. Their traditional farming and food preservations could be linked with their current resilience skills and adopt a concept of modernizing tradition and traditionalizing modernity. That is bridging the gap. Right. Food and Agriculture Organization of the United Nations says that COVID-19 socio-economic impacts have affected indigenous people across the world differently. Those who rely on their indigenous food systems and have adopted traditional lockdown practices are coping better than other communities who rely heavily on the market for their food needs. In Nigeria, for example, indigenous methods of weather forecasting are used by farmers to complement crop planning activities. Another important aspect of indigenous knowledge systems is the medicinal aspect of indigenous knowledge systems. It is very important for us to understand that when we talk about indigenous knowledge systems, it's incomplete if we leave out the issue of medicinal aspects. Now, Western science is increasingly recognizing the value of indigenous knowledge systems and is collaborating with communities to incorporate their knowledge in related projects, and industries reveal how much IKS should be given enough platform to combat COVID-19 and all effects that affect societies, economies, and health systems. Now, throughout history, traditional medicine has been a source of medicinal treatment for diseases such as malaria. And in May 26, 2020, there's a guy from Harare in Zimbabwe, in Africa, by the name Kumbirai Nongo. He wrote an article on the similar subject, and he stated that Madagascar has attracted global attention after announcing in April in 2020 that it has the herbal remedy for the coronavirus. Now you'll discover that Madagascar has been discussed from the continental level, regional level, and global level by claiming to have a remedy for this coronavirus. Right, you'll discover that also unfazed by the international criticism by scientific evidence was lacking. Now, the president of Madagascar, Andry Rajoelina, launched COVID Organics, the herbal remedy that he claimed could prevent and cure the virus. In court, he said this herbal tea gives results in 7 days. He said to choruses of disapproval from health experts and pharmaceutical companies from the usually dominant industrialized nations and curiosity from other African leaders aware that the northern companies often find a patent medicine that originate in Africa with little benefit to the continent. As we continue, now according to the Malagasy Institute of Applied Research, this is the organization that developed the beverage, which the president claimed to be curing the virus in 7 days. So they stated that the remedy consisted of a number of indigenous herbs, including the one called Artemisia annua, which is a plant with proven efficacy for malaria treatment. And there are figures from the African Center for Disease Control, the CDC, which show that as of 10 May, Madagascar had one of the highest COVID-19 recovery rates on the continent. And this is what Kumbirai Nongo listed as the statistics from the CDC. Equatorial Guinea, as of 10 May, had 439 COVID-19 cases and 4 deaths, and became the first African country to receive this product from Madagascar on 30 April. And the consignment contained 11,500 packets of COVID-19 organics weighing 1.5 tons. Niger also, with 821 COVID-19 cases and 49 fatalities as of 10 May, took delivery from Malagasy product. A health ministry official from Niger said the consignment contained enough product to treat 900 people. Also, the Senegalese President Macky Sall commended Madagascar for its efforts in the search for therapeutic solutions, which Senegal is following with interest. In the United Republic of Tanzania, President John Magufuli announced plans to import the product for use by the locals. I have been in talks with Madagascar. They say they have discovered the medicine for COVID-19. We will send a plane to bring the medicine so that Tanzanians can also benefit from it, he said. Other countries that have received the Malagasy remedy include the Republic of Congo and Guinea-Bissau. So that's one of the most important aspects that we have to take note. So this is a list of some of the medicinal plants that are found in sub-Saharan Africa that were listed by Kindamba in 2003. This is the list. So we do have Artemisia herb there. We do have the Aloe-forex, the Acacia senegal, the Cyclopea genistoides, the Momodica charentina. So these are some of the herbs that are used in sub-Saharan Africa. And this is not to suggest that these are the only ones. So this is just the tip of an iceberg. There are more of these. Right. So with regards to the above, there is still paucity of clinical evidence to show that they are effective and safe for humans. We have to take note of this point. Without this information, users of traditional medicinal plants in Africa and elsewhere remain skeptical about the value of such therapies. This denies people the freedom to choose plants that are potentially less costly and more accessible to everyone. And another issue concerning the use of botanical remedies is the need to understand the safety of these therapies. For these reasons, information about efficacy and safety of traditional medicine is urgently required. Another most important part of indigenous system is traditional knowledge and practices. Now, indigenous people have been using their traditional knowledge and practices to find solutions to the challenges the pandemic is bringing to them. As they have done for centuries, the communities continue to adapt to change while maintaining their cultures and traditions. Siambombe and Mutale in 2018, they submitted in their article that the indigenous knowledge helped the Batonga people, which is in Zimbabwe, northern Zimbabwe, to come up with the means to cope with the effects of disasters such as starvation by farming in the valleys and food and floodplains, storing excess food and praying to their gods to bring more rain to control the pests. In the face of the widespread of innovation and technological advancements, traditional knowledge systems is on the downward trajectory despite its value in community development discourse. That was according to Siambombe and Mutale. To continue with that point, so these examples as well as other traditional practices of solidarity, they display the reciprocity and mutualism with these food security and members. Right, so in conclusion, it is indeed a truism that indigenous knowledge systems can be used as a vector in combating COVID-19, as stated in the presentation above. It is important to understand what IKS means to different people and what components constitute indigenous knowledge systems. Contextually, indigenous knowledge system refers to old long-standing traditions and practices which have a significant contribution to modern resilience skills, technology, and medicine, having led to discovery of hundreds of new drugs. In this case, indigenous knowledge system was analyzed closely to understand its historicity and the immense contemporary contribution in fighting pandemics. Now we are talking about the use of language, which is linguistics, in order to convey proper messages to different native groups in the world. We are talking about the use of medicinal aspects of IKS. We are talking of traditional practices which bring people together in solidarity and suggest uniform traditional interventions for ensuring food security and fighting the effects of COVID-19. We talk of organic agriculture, indigenous-based weather forecasting, IKS-based food production, preservation, and storage. Needless to say, what remains critical is the fact that indigenous knowledge system is facing major threats as it is passed down by word of mouth from generation to generation, and the reliable custodians are the elderly who may die with this vast knowledge. Another threat is that there is still reticence in the use of IKS, which is considered by many to be anecdotal and not scientific. However, in conclusion, it is imperative, therefore, that without delay, IKS need to be protected, documented, studied, modified if necessary, then widely disseminated to promote development, and complement public health facilities. Thank you. Siyabonga. This was prepared by Alington.